In memory of the father of diabetes epidemiology, the Kelly West Award is given to an individual who has made significant contributions to the field of diabetes epidemiology. And this year, that individual is Dr. Alka Kanaya, and we are so thrilled to have her in studio with us now.
Thank you.
Thank you for your time. And we have to start off with congratulations. What an honor to receive this award. What does it feel like for you to be honored by your peers in this manner?
It's overwhelming and it's very, very gratifying. I feel really privileged to share the work of our team.
You have focused on Asian American health disparities over the past 20 years. Why has that been your focus?
I think there's just been a lack of good data in Asian American populations. Asian Americans are the fastest growing subpopulation in the United States. We've disaggregated Asian American data in many different ways using national data sets as well as local regional data sets. And what we found is that diabetes prevalence is highest among South Asians, followed by Filipinos, and then East Asian groups like Chinese, Japanese, and Koreans have sort of much lower prevalence overall. And what's interesting about that is the reasons that they have diabetes are actually quite different if you start to do a deeper dive. And even the outcomes of diabetes are quite different.
You developed the South Asian longitudinal cohort study. Is that some of the data that you gathered from that study?
It's called the Masala study. We've been doing the study for now almost 13 years. We've been seeing 1,150 participants over time. And yes, the South Asian phenotype is quite unique. It's very high risk for high blood pressure, diabetes, and heart disease, and we're trying to really understand why.
What do you hope your results will mean for the overall treatment and prevention of type 2 diabetes and cardiovascular disease?
Some of our most interesting data is looking at the different diabetes subtypes among the South Asians in Masala and comparing them to other US groups in the multi-ethnic study of atherosclerosis. And what we see is that all groups have 5 different types of type 2 diabetes, but the one that's most common in South Asians is the severe hyperglycemia type, which is the one with the lowest beta cell function and the highest levels of glucose, and that group is actually the group that goes on to develop more heart disease. And so that really points to the fact that we need to be treating people maybe who are South Asians who have this type of diabetes differently.
Very fascinating. Incredible work. Well, we certainly appreciate all of your hard work, and congratulations on your award. Very well deserved.
Thank you.